families want to know, right? Families come to us and they want to know what's the best place, right? We can't do that, right? We're sort of we have a non-endorsement policy, but what we're trying to figure out is what can we do to show that these places have gone above beyond. How can we recognize somebody who's taken essentials and have become certified, or somebody who had their own curriculum go through our curriculum review process, or we have a collaboration with the Joint Commission. How can we recognize somebody who who's been certified by the Joint Commission because our recommendations were part of their standards, the Joint Commission's surveying standards. And so we're looking for ways that through our resources, whether it be the helpline or the community resource finder, how can some of these organizations be recognized for going above and beyond so that families have more information to make the best informed decision, right? Because we can't tell you which one is best, but we could give you the tools and the resources so that you could find out which one you think is doing a good job.
Let's go.
Welcome to The Move-In, a senior living marketing podcast from Unlock Health, a full-service marketing partner for the aging services industry. Join us for candid conversations exploring the latest marketing strategies with the senior living community leaders and innovative solution partners who are moving our industry forward. Together, we'll build a community to build better communities. When a family asks, why should we trust you with our parents' dementia care? What's your 30-second answer? Hello, I'm Larry Williams, and welcome to the Move-In Senior Living Marketing powered by Unlock Health. Trust starts with training, and today I'm joined by two leaders from the Alzheimer Association, Maggie Cattell, the Associate Director of Care Professional Programs, and Dr. Sam Fazio, the Senior Director of Quality Care and Psychosocial Research. We dig into what happens when every role, from concierge to clinician, completes evidence-based, association-backed dementia education with ongoing refreshers, and how to hardwire those standards into daily routines through structured team-wide support. The payoff isn't just in care, it's in your marketing and sales process. Stronger trust, clearer conversations from first inquiry to tour to move-in, incredible proof points that differentiate your community. We're breaking down exactly how to connect your community, train every team member, and turn person-centered from a buzzword to a practice. Here are a few things we discussed in this conversation. First, how to plug into Alzheimer Association resources. Second, how to train everyone and live it daily with leadership buy-in. And third, how to implement and prove it, which adds to confidence and retention, plus marketable proof such as certifications and completion rates. Let's dive in. All right, we're on the Move-In Senior Living Marketing. I have yet another friend, Maggie Cattell, with us, as well as she introduced me to Dr. Sam Fazio. Did I get the name correct, Dr. Fazio?
Sure did.
Awesome. That's great stuff. So just before I pass along to the introductions, I just want to let everybody know that Maggie and I met at Argenum in 2025 and struck up a quick friendship. I think anybody who would hang out with Maggie, you'd quickly become friends. And so I got to meet her, understand why they were at, when I say they, the Alzheimer Association was at Argenum. And we had a quick conversation. I asked her to join us on the podcast, and she said, yes, that'd be great. But I want to ask Sam, who I will always refer to as Dr. Fazio, to join us as well. So thank you both for joining us. I'm going to hand it off to you both for introductions so you can tell us what you do at the Alzheimer Association. So I'll start with you, Maggie.
Hello. Thanks for having me, Larry.
I like that official
Maggie.
Hello.
Hey, thanks for having me. Yeah. So I work for the Alzheimer's Association. I am the Associate Director of Care Professional Programs. So I get to do a lot of working with skilled nursing communities, assisted livings, people who are on the ground and doing this fantastic work. But then I also get to do these opportunities of going to conferences and talking about what we do too. But also a lot of what I do is I support Sam and all of his work as well. So be that whatever it is, I tend to be a jack of all trades in that way.
I like it. So you're just there to really promote Sam, carry the boombox behind Sam as he walks through conferences.
I'm his hype person. I'm making sure that Sam's getting all of the clout and jazz that he deserves.
And I always say that I'm working for Maggie, so and others like her. I just do what they tell me to do. So
It's the
that's why we get so
dynamic
much
duo right
done.
here.
Yeah, it really is.
Well,
Maggie,
all right,
the
I'm
great
going to hand it to you, Dr. Fazio.
yeah, and please call me Sam Leary. Like,
Okay.
and so yeah, the great thing about Maggie too is Maggie came from one of our chapters, so she worked in the field before she came to home office. On the other hand, me, I worked in the field, but I started out in a adult day center specifically designed for people with dementia here in Illinois. The first one that was being built in 1987, long time ago. And then came to the Alzheimer's Association in the early 90s, where I've been for 31 years. No gray when I started, and now I am completely white. So I had many roles throughout my 31 years, but right now I oversee the care and support programs and research area. And to just be brief, it's everything we do for individuals and families. So all of the programs that we offer through chapters, online, virtually for individuals and families, everything we do for care professionals, which we'll be talking about today, and then everything that we do in psychosocial research, where we're really looking at defining and measuring person-centered care and having large studies that do that. So I'm excited to be here and glad that you guys let me into your friendship here. So maybe I can hang out at the next conference.
100%.
Okay.
Part of the team now.
That's right. The trifecta. And I'm going to be right there with Maggie and really cheerleading you at this point, Sam. So going back to Argenum, again, I mentioned to you before, Maggie, that it kind of surprised me that the Alzheimer Association would have a booth, at Argenum. And so you explained a little bit to me, but I'd love for you to share with the audience today of why you had a booth and how you're connecting with communities.
Yeah, and I think, it's funny because we balance this line of making sure that we're having a presence. We want people to know who we are and all it is that we're doing, but we also want to open up the door for really meaningful conversations. I think as we continue to grow and expand, especially the way that we're impacting care professionals, it's important that we're talking to people, listening to what's going on in their communities, hearing what their struggles are, because that allows us to innovate and to help meet those needs. And I mean, over the past 5 years, especially, things have changed so much. So I think when I'm at a conference, and I think Sam does this too, and a lot of our team, not only is an opportunity to be vocal, to be visible, to let people know that we're here and we're supporting them, but also to listen to what it is that they're doing, what it is that they're hearing, they're struggling with. Because it opens up a door for us to see how we can be providing better support, how we can be evolving in the way people need us to evolve.
For sure. And I appreciate that, just because I think that's one thing that these events provide us, which is instead of having just a microphone, it's an interaction. It's back and forth. So when you're at these events, you can actually hear what's going on others, within, other spheres, and you can also provide more context into what you're doing and how you're providing support. And that's why I appreciate you bringing Sam into this conversation, because he is really leading the charge in providing some of these resources.
Yeah, and I think it's so valuable when you have so many people there and the conversations are starting.
Yeah.
You have these incredible sessions that people are talking and reflecting about. You have these small tables where people are taking what they're learning and then they're discussing what it looks like for them, what they've tried and what they, haven't been able to successfully implement. And it's incredibly valuable. It's also energizing too, for that matter.
For sure. Yeah.
One thing I'd just add, Larry, is that, we have a budget each year and we have to decide what conferences we're going to go to, right? And we strategically decide, which ones are going to make the most sense for us to have a presence to really have the biggest impact. We're all about, making sure that people are delivering the best person-centered dementia care possible, right? So how can we make sure that happens? And so, like I said, we're very specific in where we go and very specific in our messaging now to really, talk about the different products and programs we offer communities. And if that's okay with you, maybe we could just talk a little bit about some of that.
Please. I love that. Yeah. Jump into it, because ironically, that was my question to you. So I'm glad you made that segue for me.
There we go.
We're
already reading each other's minds.
That's right.
So we developed, we worked with experts to develop the dementia care practice recommendations. They're all available on our website at alz.org/quality care. And they're 56 recommendations in 10 different areas. So 3 to 5 recommendations in each of the 10 areas, grounded in person-centered care. And it's really based on the evidence that's out there about if you provide good person-centered care, what outcomes can you have both on the individual level and on the system level? So how can you really, increase quality of life or decrease dementia-related behaviors? And at the same time, how can you impact job satisfaction and staff turnover for the system? And so those evidence-based recommendations have really become the foundation of everything that we do at the association. And so things like essentials, training and certification, Project Echo, video-based learning, some of the work that we do with the states on civil monetary dollars. And then our most intensive product is 6-month community care coaching, where we really send a coach into a community to really talk about how they could build an action plan and really implement and adopt those recommendations. And so we can talk about each one of those things separately and, give you a little bit idea of those. And if Maggie, I don't know if you want to start talking a little bit about essentials and work your way up.
Yeah, sure. And I think really some of the things that we're doing, the idea is if we're putting the right tools in each person's tool belt, what an incredible experience that a community member, a resident can have. But also there's this idea around system change, really talking about the culture that is happening in a community, and that, if there can be this energy, this snowball effect, where if what could be a 10-minute long argument with somebody instead can be an opportunity for connection or even enjoyment, that catches. And that's what we want. We really want it to be something where there's, again, it starts to pick up and it continues to roll. So one of our
the other thing, Maggie, I think that you were saying there that I think makes a lot of sense is that when we looked at our products too, we want to make sure that it's not all about one person. You know what happens a lot in training, right? Somebody gets trained, you have a really good employee, they leave, and then it goes downhill. So we're looking at how can we really embed this philosophy into the whole system so it stays at the community even when that star leaves. Sorry.
Yeah, I feel I
That's okay.
hear what you're saying, Sam, which is it can be a vacuum if you don't provide it throughout the community level. And that's one question I was going to ask you after 31 years. Is that a big change you've seen? Is this approach and how you provide these resources and who you're speaking to, where it used to, I'm guessing, be, a handful of, care professionals to really all staff at the community?
Yeah, I mean, it's kind of loaded, Larry, because sometimes I say like it's really exciting that our first recommendation is know the person, but I also think it's really sad that after 31 years we still have to say you have to know the person you care for. So it's sort of it's exciting to see person-centered care grow so much that we could start measuring the impact of it, right? But it's also sad that we're still having to explain what person-centered care is, right? That we're still having to sort of challenge the medical model and help people understand that if you get to know who this person is their whole life and weave that information into everything we do throughout the day, it just makes a better experience for everyone.
For sure.
So
and I think person-centered care has become a little bit of a buzzword too. And I think becoming a buzzword, it makes it a little dangerous because it means people are talking about it. There are plenty of conversations, especially with the coaching project that we've been having, where we ask people, what are they implementing that's person-centered in their community? And we realize that there's a lot of confusion. It's easy to talk about the word, to hashtag it or, whatever. But when it comes to operationalizing it and really making a part of your daily practice across multiple staff, we find that that's a little bit more loaded, a little bit more difficult.
Yeah, I would say over those 31 years, we probably went from more of a care philosophy to a marketing buzzword, right? Everyone's talking about person-centered care. But when you really ask them to define it and describe what they do, there's not a whole lot there, right? So we're trying to move away from that and get back to really helping people understand what the essentials are of person-centered care, so that we could really provide the best care possible with the minimum standards as possible, because perhaps what we're trying to accomplish is too big for people. We need to think about what's good enough. What can we do so we could have people getting good care all over?
Yeah, I'm sure it's not just get to this level, but really how do we exceed it? And
Yeah.
and just, kind of going into that next level, have you seen just interaction with your organization, with the Alzheimer Association, where, just with your leadership, it can build more trust and credibility with families and really provide more of that guiding light from a larger perspective, like you're speaking of?
Yeah, I mean, so families want to know, right? Families come to us and they want to know what's the best place, right? We can't do that, right? We're sort of we have a non-endorsement policy, but what we're trying to figure out is what can we do to show that these places have gone above beyond? How can
Yeah.
we recognize somebody who's taken essentials and have become certified, or somebody who had their own curriculum go through our curriculum review process, or we have a collaboration with the Joint Commission. How could we recognize somebody who, who's been certified by the Joint Commission because our recommendations were part of their standards, the Joint Commission's surveying standards? And so we're looking for ways that through our resources, whether it be the helpline or the community resource finder, how can some of these organizations be recognized for going above and beyond so that families have more information to make the best informed decision, right? Because we can't tell you which one is best, but we could give you the tools and the resources so that you could find out which one you think is doing a good job.
What are some of the most popular tools and resources that you provide that communities typically want to take advantage of? Or did I just ask another loaded question?
No, it's a range of questions, and I think I'll start. I think I'll start talking about the continuum. So we basically have information and referral and care consultation that's through a 24/7 helpline. Anybody could call that, get information, referrals, like where's the nearest support group, or how can I find a residential community, or you could talk with a licensed social worker and nurse and really work through an issue that you're having. Then there's education and support, right? So there's all sorts of education programs that are available in person, virtually, and online. Same thing with support groups. And then we have a bunch of e-services, online resources. So in addition to the education programs, there is All's Connected, which is an online support community. There's Community Resource Finder, which is sort of like INR on your own. You can find out what's in your area. And then All's Navigator, which is sort of like care consultation online, where you could build a plan to navigate your journey. And so all those are sort of like for families and professionals. But I think like the products that Maggie was talking about, and I think one really, really interesting one is our dementia care provider roundtable. Larry, I don't know if you know anything about that, but it's a really cool opportunity for communities and chains to come together to better person-centered care in a non-competitive environment. And Maggie, I don't know if you want to say a few words about that.
Yeah, and I think what's neat about the roundtable is it's this opportunity to come in at a level playing field where you have companies who are really trying to embed person-centered care into every day, and for them to discuss, well, how are we operationalizing that? What new things are we seeing? I think the last meeting we talked about tech. How is tech playing a role into person-centered care? So there is this idea of bringing a group together to talk about change, but also to talk about innovation. But I think that's what's neat is there's this opportunity to hear what other people are trying and to learn from their successes or from their struggles. And I think with the roundtable, it also allows us to provide the space, again, with that even playing field where nobody is coming in and trying to compete with each other. They're coming in as a collaborative, as a group effort, and with the commitment of offering the best care that they possibly can.
Yeah,
And literally right now we have 32 companies that are part of our dementia care provider roundtable.
oh wow, that's incredible. And you mentioning this just takes me back to why I love serving the aging services space so much, just because it is a community of,
Yeah.
really just looking to constantly improve, and you don't see the competition as much. And it's there, but at the same time, I think we all want to come together to provide a better service and learn from one another. And so, going back to Argenum, when people stop by the booth, Maggie, like what are the typical questions they have for you, or what are the conversation topics?
The first thing that most people say, Larry, is they talk about their own personal experience with the
Yeah,
disease. And
for
I
sure.
mean, and Sam, this may be the same for you, but it really doesn't matter what space we're in as people are coming up and they're talking about their parents. They're talking about, their brother or sister. They're talking about
Yeah,
their grandmother. Um,
I also
and
think the other thing,
even
Maggie, is there's probably people who also talk about I'm part of walk, right?
Yes, they
yeah,
talk about the walk. They
I'm
talk about
part
the
of
walk
walk.
that ends
Yeah.
Alzheimer's. And so what's so funny is even though, they're a DON or they're an administrator or, they're, a regional director for a large management company, they still come at it from a very personal lens. And I think that it shows why we're in this space is because there's been this heart, this caring that drives people's motivation to want to work in the aging space. And then what's really neat is it does open the opportunity for us to listen, to hear about what their story is, to hear about their why. And then it also allows us to know, okay, well, how can we support that? How can we help? And that's where we can talk about, okay, if there's still an active caregiver here, if you attended one of our support groups, have you gone to the walk? Or, if their loved one has passed and, they have questions about the community that they're working in, that's where we can then get very specific because each of our programs, it can be very unique to the community, to the residents, to the staff that are currently in that space. So it is kind of neat how the conversation starts at this really 9 times out of 10 starts at a very personal level
sure.
and then can mature into this really lovely conversation about how we can help, how we can support.
Yeah.
But yeah, the walk is another one. They'll talk about the walk to end Alzheimer's and, the powerful experience of attending the walk, which is cool too.
Yeah, that's awesome. And like you said, it just goes back to that community perspective of
Mm.
starting with that one unified goal, and that starts with that personal experience. Since really this is for more of a sales and marketing audience, I'm kind of curious, like how can your services really help those in the sales and marketing field? I'm sure you can really help that group provide more credibility and trust by just through these resources so they can speak with families on a different level.
I think credibility is a great word for that.
Yeah,
Being able to talk about not just a community's commitment to person-centered care, but here's how we're doing it, and being able to link it to a very trusted resource, and that is us at the Alzheimer's Association. But I think it also centers back to what Sam was talking about, that our dementia care practice recommendations are tried and true. They are this foundation that all of our programs have been built upon. So these aren't things that were just thrown together and we say, yeah,
sure.
that works. These are things that we know in the field are, can be helpful, things that can really drive that change. Sam, I don't want to talk about the practice recommendations with you right there, just in case I'm misspeaking.
No,
Was
no.
that,
No,
did
I
that
think
seem
Yeah.
okay?
and I think also, I think with some of our other products like Essentials, training and certification, when their community goes through that or curriculum review,
Yeah.
so Larry, just so you know, like there's two ways to sort of become certified in Essentials is you could take our online course, or if your community has its own existing curriculum, it could go through a review process. So we make sure that it includes all the great information from the practice recommendations. So then you have two pathways to get certified. And when somebody gets certified, they love to show that off. They get language of what they could put in their newsletters or what they could display at their, reception desk.
Sure.
So those really exciting individuals get certified, but sometimes an entire organization might get certified, right?
Mhm.
Or an entire chain might put their program through curriculum review. So then everybody at all of their 75 locations have gone through that training, So that's an exciting way that sales and marketing folks could show that they're doing something different than
Absolutely.
than a different community.
Well, it goes back to what Maggie said earlier, why credibility is such an important word in this conversation.
Yeah.
And then, I was thinking about, are there any co-branding practices or anything? But it sounds like there are in terms of that certification, which groups can really highlight and encourage others to share if this community has gone through that certification process. I feel like that makes them stand out on a different level.
Yeah, they get recognized through that certification and what they can say. The other thing with the provider roundtable, their logo is on our website then as one of the roundtable members and links to
Mhm.
their organization. So
Right.
that's probably a little bit more where they get a branding opportunity.
That's incredible. So, kind of moving up the I'd say the chain of command, what role does VPs and executives play in really taking this on and really encouraging this, adopting more of these resources and guidelines, within their community?
Yeah, I mean, I think the biggest thing, and we've struggled with this over time, right? Because people come to training programs and they're like, "This is all great, but I can't make these changes.
Mm.
I'm not high enough." So I mean, a lot of some of the data that's in the recommendations and what we try to build with a lot of our programs is really leading by example, right? So how can we really talk with leadership about how they could really embody person-centered care and how they work, right? And some of that's even just as a leader, how do you step in to help somebody out who's having a bad day, right? How do you lead by example and have this team environment? You can't just sit in your office and not do anything and say that you're a person-centered leadership team, right? You got to be in there in the trenches sometimes and help people out. Maggie, I don't know what else you'd add.
I think that's fantastic. I think, the coaching program that we have, it's supposed to include leadership. It's supposed to include both levels of people who could be in a community. And the thing is you can have people who are really excited at the ground level, like Sam said, but if you don't have somebody who is really driving this, who's putting some strategy behind what does this look like for us and how do we sustain it? What does this look like if our all-star does leave, the person who we decided to go through and certify? How do we still make sure that this fantastic opportunity for providing great care is still there? And you have to have it at both levels. There has to be a general understanding that this is a commitment to us as a community or as an organization for that matter. I mean, there's many organizations where we're working across multiple communities, not just one, but there has to be that buy-in at both levels because if not, it can fizzle out. It can be short-term.
Yeah.
Yeah,
But
and go ahead, Sam. I'm
I
so
was just
sorry.
going to say right now, our essentials program is really for the direct care worker. As we go into next year, we're building a leadership track to that so that
Mhm.
leaders can take that. And then, like Maggie said, with our coaching, which I think has been really significant. So our coaching, just really quickly,
Yeah.
it a coach goes into a care community for 6 months and builds does an assessment against our dementia care practice recommendations and builds an action plan for implementation over those 6 months, reassesses at the end of the 6 months. And part of those monthly coaching process is with a team of people from that community. And it has to include the leader and direct care staff. 3 to 5 people can be included, but we have to have at least one leader and one direct care staff. So as a group, these people are making the changes over the 6 months. And we just completed a randomized control trial in the state of Ohio with 80 care communities, and we got some really cool results related to competence and job retention that will be coming out in an article soon. So we're really excited about this new coaching service.
That's really awesome. I appreciate you highlighting that, and it just made me think about the importance of going through this as a team instead of as
Yeah.
individuals. And do you have any feedback on that front? How it could be impactful to go through this as a more of an organizational level or as departmental instead of just siloed?
Yeah, I mean, I think right now, Essentials is set up as an individual course, right? But we do talk about how there's bundling. So the more you purchase, the cheaper it is. And so
Mm.
you could definitely have a lot of folks do it. And like I said with the curriculum review, if you already have your own curriculum, if it gets reviewed against the practice recommendations everybody has access to that. But as we look at new products based on what we're hearing from people, we're looking at ways to like maybe bring in facilitator guides so that perhaps leaders can use what people learned in essentials and have conversations on a bi-weekly or monthly basis, or like I said, the leadership module or other pieces. How can we help enhance what people learn to make conversations in the team? And I think, if you haven't heard of Project Echo, that's one of the things that's really cool. That's another service that we offer where it's all case-based learning. So you come together on a video call and somebody presents a case and everybody works on it together to solve that case. And so there's ways that teams are being involved in that aspect of things. But Larry, I think it's a key point of how we continue to look at how to move beyond just individual learning, right? Because individual learning just stays with the individual.
Yeah. And I feel like individual learning then becomes more like a test for, that you would take at school. You go through that. We're comparing that to a sharing of knowledge and sharing of ideas and sharing of experiences. And Maggie, like you mentioned, when people come to your booth, it's that personal experience that they had. And then I think if they can come together with the guidebooks and these resources, but then share, what their experience has been, I think that makes it even more powerful, it seems like.
Well, even dedicating time in it in service. So, one of the grant projects that we have, we're utilizing CMP dollars across multiple states. And we're talking about this from both a leadership, a frontline, and even a family perspective. And the idea really is we're working with them over multiple years because we want to talk about, again, somebody went through and got trained. Well, what do you do after that? It doesn't just stop there. And I think the pitfall that we sometimes can get into is that we spend so much time on the computer, right? We have to get so many CEUs that it's easy for you to listen to it, complete the test, and then that be done. And so when we then talk about Project Echo, where we can bring in an opportunity for, case studies to talk about what's actually going on. When we talk about circulating support groups or education programs, so that way the families also have resources. And then putting that over a period of time where it's longitudinal, it's almost this thing where if it continues to show up and it continues to be this steady resource that is there, that there's opportunity for it to become something that's part of the establishment where it is a foundation for that organization.
Yeah, and question for you on that, Sam, is the resources. I imagine it's almost like this living, breathing document where the information is constantly changing and being updated. How important is that to stay in tune with the changes that are taking place?
Yeah, I mean it's very important, but at the same time, Larry, there's still this foundation of person-centered care that people don't understand yet, and that we're still driving the same message, but we're thinking about how we drive it in different ways and how we support it. So I think, the old approach was probably you give people some information, training, and you send them on their way. Now, we're really looking at how we engage people over time, right? So that we support them through this change, because person-centered care is just not one and done, right? We're constantly having to challenge ourselves to think differently about things. And so as we think about our products and programs and support, how do we support people over time, and how do we go from low intensity to very high intensity so that there's something for everybody?
Yeah, and I appreciate that. And like you said, I'm putting words in your mouth. I don't mean to, but it's not just a checkbox. You don't do it and you're done. And I feel like the way we provide care is constantly evolving and changing. So I think that's really important to note as well. We've gotten about 30 minutes in this conversation. So here's a really important question I want to ask. What have we not covered in this conversation? Is there anything that you think it's important to highlight that maybe I didn't ask a question about?
Maggie, anything you can think of?
No, I think knowing how to get in touch with us, I think, is incredibly important. So Sam mentioned the alz.org website. Not only is that a way that you can contact us, it's just a slew of information. So I think from a professional standpoint, that is a way that you can connect families that you're working with, but it's also an avenue to get resources from a professional level too. So I think making sure that you know what the website is and how to get to it is definitely a critical part. That's the thing that pops most into my mind.
Yeah, thank you for adding that. And so I got two more questions. And I'd say this is more for you, Sam, which is, you mentioned the coaching aspect. Are there any other, really guides or information that you're really excited about looking into the future?
Well, we're coming on our 10th anniversary of the dementia care practice recommendations. So I think we're looking at how we're going to either revise them or develop them a little bit differently, But um, I think that the coaching model and the findings associated with the model, as well as all of our other products, we're doing randomized control studies on all of them to show that they have outcomes. The fact that we could show that person-centered care approaches can make a difference for the care you provide, but also for that community, for that system, for the ROI, it's exciting.
Yeah.
Really exciting. It's a lot different. Like I say that when I first got involved in this, it was all very morally driven, right? I think now we're at a point that we are driving all this by evidence. And I think that sometimes that's what people need to make an investment, right? And so it's exciting to see that.
That's great. I love that. Is there anything you wanted to add, Maggie?
No, I think that's spot on. I think
Yeah.
especially right now, there are so many ways that you can get trained and certified, so much information that you can take in. And so being able to have that level of discernment and saying like, oh, this actually has some research behind it. This has some fact. That feels incredibly powerful. And yeah, I can't wait until we release the coaching information, because some of the things that are coming out from that is really, really neat.
And I'm guessing they can find that on the website that you mentioned earlier, Maggie.
Yeah.
Awesome. Now, where can people find you if they want to learn more?
I think the best is alz.org, but if you go to specifically alz.org/quality care, you can see everything that we've talked about related to resources for professionals.
Awesome. All right, Maggie, what about you? What events are coming up that you're going to be attending?
So we're going to be at Leading Age for sure. We're going to be at ACA NCAL as well, GSA. We're kind of going into our big conference season, which is really an awesome opportunity for conversation. We hope people will find us, stop by our booths, because we would love to hear about their experience, both personal and professional. It's important people know that we're open to those conversations and that we're there as a resource.
Absolutely. I appreciate that. And can people connect with you on LinkedIn if they want to, find a time to connect with you at these events?
Sam, are you a LinkedIn person?
Unfortunately, I'm not. So it's got to be you, Maggie.
Got to be you, Maggie.
I am a LinkedIn person. It's LinkedIn has become such a valuable tool going into these conferences. I think, Larry, you and I have connected on it. That's how I am able to know kind of who's going where and be open to those conversations. Because absolutely, there's the opportunity for a conversation in a booth. But how much more special is it to grab coffee with a couple of people and really dig into what it is that they're hearing, what it is that they're experiencing? So please reach out on LinkedIn too.
It's nice that you can start a conversation on LinkedIn and get to know someone and then actually meet them at the event, or you meet them at the event and get to know them as a person. Then after, you can connect with them on a business level. So I'm right there with you, Maggie. So, hey, thank you both for joining me today. This is a really important conversation, and I appreciate your time.
Yeah, thanks you for inviting us, Larry. Appreciate it.
Absolutely. All right, that's a wrap. Huge thanks to Maggie Cattell and Dr. Sam Fazio from the Alzheimer's Association for cutting through the buzzwords and giving us a clear path to trustworthy dementia care. Here are a few takeaways that I made notes of in this conversation. First, make training all staff and ongoing. Put every role through baseline dementia training, make refreshers into your calendar and onboarding, and have leaders model it. Second, plug into programs with owner in a timeline. Assign a point person and schedule a 6-month community coaching, then hold those dates. And third, measure and market. Track completion rates, certifications, and coaching milestones. Share them on tours, your website, and one-pagers, then monitor the outcomes. As always, thank you for listening, and a big thank you to both Maggie and Dr. Sam Fazio for joining us for this important conversation. And until next time, let's go create some meaningful connections.